Hey, Margie here. So many of us are exercising, but are we doing the right types of exercise that can actually help prevent fractures and keep our bones strong and resilient for years to come? Well, today we have a powerhouse expert with us, Dr. Claudia Tamas, who has dedicated her career to understanding how movement strengthens bones and protects against fractures. And she's here to share exactly what exercises have been scientifically proven to make a difference, why they work, and how you can start incorporating them into your daily life. Dr. Claudia Tamas is a physical therapist, a certified strength and conditioning specialist, and the director of women's health at Natural Medicine and Rehabilitation in Somerset, New Jersey. She is the first clinician in the United States to be a licensed provider of the ONERO program developed by the Bone Clinic in Australia. And this episode was recorded as part of my most recent summit, More Natural Approaches to Osteoporosis and Bone Health. And so many people thanked me because they found the information so useful that I want to share it with all of you. So make sure to stay to the end when Dr. Claudia demonstrates 2 easy and powerful exercises you can immediately put into your life. So enjoy the episode. Welcome, Dr. Claudia.
Thank you so much, Margie. It really is an honor to be here and such a great opportunity. I have so much to share today. And I do think that I come as a bearer of good news for bone health in this program. So I'll go ahead and start sharing my slides. And
Hey.
Our bone health is heavily influenced by our lifestyle. Factors such as physical activity or exercise, our diets, and our stress level play a huge role. But today we will discuss one lifestyle factors in particular, and that is exercise. We're going to look at ways in which it impacts our bone health and consequently the quality of our lifestyle and our ability to remain strong and independent all the way into our later years, and of course, to avoid fracture. We know that osteoporosis is more prevalent in the Western world and that there are communities around the world, particularly in the East and small communities in the Eastern Europe, for which osteoporosis, or at least the concern for low trauma fracture, is very low or virtually inexistent. I grew up in a community like this. So I was born and raised in a small community in northern Romania. And as you can see from the picture, it's a very, very hilly region. You couldn't even ride a bicycle there. The terrain is so bumpy and hilly, so you had to climb everywhere. Now today is modernized, but almost 50 years ago when I grew up there, we didn't have roads and we didn't have modern ways of transportation. So anything that required transportation, from babies to food to water, supplies for ourselves and our animals, was carried on our backs. Both women and men performed high level of physical activities from a very early age to a very old age. My grandmother, who stood a little bit below 5 foot, very small framed woman, was one of the strongest people that I know. Her and I would partner through the summer, and we would make these haystacks together. And this required carrying hundreds of pounds of hay here to the side. So then she could push it overhead to me, who I was standing right here. Now, this process would require that she would lift 15 to 20 kilos overhead repeatedly. And this process took about an hour and a half, and sometimes even longer. And my grandma and I partnered through this all the way through her 60s and even through her 70s. I later learned that other communities around the world, such as China and Gambia, also had very low or inexistent fracture rates. And a trend started to emerge when I was exploring their lifestyles. Their lifestyles were very similar with ours in our community and involved lifting and carrying heavy weights, pushing, pulling, squatting, and lifting overhead. By contrast, as you can see in this picture, the modern life in the West unloaded the body to enhance our life experience and to make our life easier. But we can argue that in the process, as a consequence, our bodies adapted to this lifestyle, which has lower requirement for mechanical load by creating weaker muscles and weaker bones. We know that all women lose about 15 to 20% of their bone mass around menopause. But because in our community, in the community in which I grew up, DEXA scans were not available, nor necessary. I was wondering if these women that had such low fracture rates did not get osteoporosis at all, or was there another factor that was fracture protective? And this was an important question for me because I wanted to learn how can we mimic those movements, those lifestyle in the clinic with my patients in order to reduce their fracture rate. So let's take a look at some research that may answer these questions. If you focus your attention on the study on the left, this is a very old study. However, I believe that it was still very relevant. I haven't found any recent studies that compared any of these communities to the modern world. In this study, researchers turned their attention to a group of women in Gambia where the fracture rates were very, very low or inexistent, and compared their DEXA scores with women in Great Britain. This was a very interesting research. They found out that although these women in Gambia never fractured, they had low bone density score. Actually, some of their scores were 30% lower than the women in England, which had a much higher fracture rate. So despite low bone density, these women were not fracturing. So to my first question, maybe there is more than bone density alone when we're talking about fracture risk. So the next question is, what kind of lifestyle do these women have? Their lifestyle involved activities very similar to those in my community that involved squatting, pushing, pulling, lifting, carrying, in which they exercised with their hip flexed. And we believe that those particular activities and the fact that they maintain good muscle quality on their bodies is what was actually fracture protective despite their low bone density scores. A newer study from 2023, which you see here, supports that hypothesis. In this study, the researchers looked at a muscle that runs along the spine. This is the multifidus muscle and supports the spinal architecture. And they found that independent of bone density, patients had or people had a higher fracture risk, higher fracture rates if the multifidus muscle was found to be weak or have fatty infiltration. Fatty infiltration of a muscle occurs if a patient is sedentary or if the muscle is not exercised. So independent of bone density alone, the quality of the muscle along the spine was a determining factor for fracture risk. Another study looks at calf muscle density and comes to the same conclusion that independent of fracs or bone density or history of falls, greater calf muscle density is associated with lower fracture risk. In 2017, the article was written in 2019. Cambridge University researchers compared the bone density of this humerus bone, which is the arm bone of a female from the prehistoric age. They calculated that it was 6,000 years old. And they compared the bone density with a female humerus that was 25 years old on the Olympic track team. And surprisingly, the 6,000-year-old bone had almost 30% higher density compared to the young athlete today. I think this is important when we're looking at early prevention. Now, this could have been a younger female, so it's not a postmenopausal bone. But it's important, again, to ask the question, what kind of lifestyle were these prehistoric women involved in? And not surprisingly, once again, we're seeing the same movement patterns, the same lifestyle that I experience in my community and learn about communities around the world in which fracture rate is very low. Heavy lifting, pushing overhead, pulling, carrying, and squatting consistently was part of the lifestyle of this person at the time. And then for the first time in history, researchers from Australia, Dr. Belinda Beck and her team, for the first time put together high quality research which incorporates those very movements. They had 101 subjects, and they involved movements. They were compound, just like the ones described in the lifestyle of these communities. They involved heavy lifting, pushing, pulling, and squatting. And it was no surprise that they found incredible results. They had incredible results, not only in bone mineral density, but in physical function, including muscle strength, balance, body composition, and fall risk was reduced. Fracture risk was reduced by 70%. And I jumped for joy to see this amazing high quality research. And this resulted in ONERO and the ONERO program, which we brought to the United States, and we have been running in our clinic for the last 3 years. So you may be wondering, but how do I know if my muscles are weak? Because the only assessment that is offered for women around menopause and postmenopause is a DEXA scan, which assesses bone density. Well, we know that muscle strength and muscle quality is important. So you can see a physical therapist and have them assess your muscle strength. Here on the screen are just 2 ways in which we can assess this, but there are many others. On the left, we have a sit to stand test. In this test, we're asking the patient to sit and stand from a chair 5 times, and then we record how fast they can do it. This test also allows us to watch the patient move, to see how they perform these movements. Do they struggle? Do they need to use their arms? Are they symmetrical? Do they lean forward a lot? What is their posture like? So a lot of good information that the therapist can record from this test and then design a special program to increase your muscle strength. Here on the right is one of the most researched tests for strength. It's a grip strength test, and it measures your ability to grip, the ability of the muscles and quality of the muscles in your hand and forearm. Based on this test, we can extrapolate that if these muscles in the hand become very weak and deconditioned, most likely the rest of the muscles in that person's body are in the same condition. This test is not always, cannot always be used, especially people that have rheumatoid arthritis or hand deformities. But there are many other tests in which your therapist can assess your muscle strength and get you started on a journey to strengthen your muscles. Another important assessment is a single leg test. These are all very easy assessments. I believe that the single leg test should be part of every single primary care yearly exam. It's very easy to do. A lot of research on this as well. One a couple of studies that I have here look at the ability to stand for at least 10 seconds. A lower than 10 seconds time standing on one leg without support is a high predictor for fracture risk in older women, and this is independent of any other clinical factors or of bone density alone. If you want to perform this test on your own, please do it close to a wall or something that you can hold on or to your counter, or better just see a physical therapist and have them assess you because they can also structure a program to improve this if the results are not satisfying. And here is something a bit newer. We are looking at toe strength. And yes, I did say toe strength. And surprisingly, this is the best predictor of a senior citizen falling. This is a result of a study in which they looked at 300 adults and discovered that those who weren't falling had 20% more toe strength than the seniors who fell. We can strengthen our toes in many ways, see a physical therapist about it, or even better, go on humanlocomotion.com. Tom Michaud has this device there specifically designed to strengthen your toes. And once you go on their website, it's like walking on a gold mine of information. So a lot of really good information there from Dr. Michaud. Now, we all know that posture is important, but I would argue that for patients with osteoporosis, posture and postural architecture collapse is a matter of life and death. Allow me to explain. Let's focus our attention here on the left. This depicts 3 pictures. The one furthest on the left represents normal posture. Normal posture, we're looking at landmarks such as the earlobe, the shoulder, the hip, the knee, and the ankle. A straight line could go through them. The picture in the middle, you are going to notice some changes. And the most noticeable change is that her head has now shifted forward, maybe an inch or so. As a consequence of this forward head shift, we are seeing an increase in the mid-back rounding, which we call kyphosis. These structural changes increase the compression forces into the upper cervical parts and thoracic part of our spine. And another important change that occurs here is that the muscles that support the spinal architecture, the muscles that I was showing you in that representation earlier that are fracture protective, they become lengthened here and they become weaker. Moving along on the third picture, we are seeing the head has shifted even more forward and more compensatory changes have occurred. Now, if we're looking at the musculature in the back of the spine, the fracture protective muscles are weak and long, and the thoracic spine has even a higher deformity. A third consequence of this posture has to do with vital functions. We are noticing that this kyphosis or hyperkyphosis, this is what we call the rounding of the back, causes a collapse of the rib cage here in the front. You can look on the model. The rib cage is in the front. The more we collapse forward, the more the rib cage collapses onto a vital organ. We have the heart and the lungs here under the rib cage, now restricting that person's lung capacity and vital capacity. Alongside with this, we're seeing a shift anteriorly of these organs, the gastrointestinal organs, are moving forward. So this belly here that you see on this person is a consequence of the anterior collapse of the rib cage and of these organs being shifted anteriorly. One more problematic issue that happens is that pressure downward goes into the pelvic organs, creating issues with prolapse, urinary and fecal incontinence. And then when we're looking at the nervous system, we're seeing that there is increased traction. Now the spinal cord and brain connecting here. There is increased tension into the brain and spinal cord, creating many problems, including cognition, mood issues, headaches, and of course, musculoskeletal pain. And why is this important for the person with osteoporosis? In this third picture, we are witnessing a person that has lost not only strength, musculoskeletal strength, or their aesthetic looks. They actually lost vital functions, such as lung capacity. And someone like this, if they suffer any health event, they are unable to recover. They are in a state of physiological bankruptcy. Now, why is this important? Because we know that the rates of recovery, particularly from hip fracture, are very, very troubling. 30% of people that fracture are not able to recover and they die within that first year. And another 30% lose their independence. And I can't stress enough how important these changes are when it comes to preservation of our body's resources to recover from any health event that could occur, including a fracture. So how could you know if this is a problem for you or even the beginning of a problem? It's very important to understand that postural alignment is not something that is self-correcting, or you cannot correct it just by being aware of it. It needs to be assessed and it needs to be addressed with very specific exercises. Now, in our clinic, we use a sophisticated program. It's called Posture Pro. And we take a picture of the patient, and then this program measures all these angles. So it's fun for the patient to see. It's super eye-opening. But you can work with your physical therapist. It doesn't have to be a very sophisticated analysis, and they can measure these postural changes and give you an individualized program. So you can start make corrections before it's too late. As you're noticing in this picture, a front posture picture is taken and then a lateral posture. Now this is a educational picture from Posture Pro's website. So this is not our patient. It's just used for education purposes. But you will see here that the earlobe is marked and then the shoulder. And this is the most problematic measurement, as I was showing you in the diagrams before, the head shift. And we need to correct that to bring it back in order to avoid compression into and loss of lung space. This angle here that is measured, and you see 23 degrees, in a normal posture, this should be 0. And I can tell you how many of these measurements we've taken in the last 3 years since we're seeing patients in ONERO. And I haven't seen anyone with 0 yet. But it's measured to the vertical. So the further away from the vertical, the more problematic this is. And then the computer kind of undresses the muscles and gives us measurements for the compressive forces through the spine. So this is fun for the patient to see and very, very eye-opening. Here is something that I thought was important to share once again when we're looking at why our recovery rates are so low. We can see that in patients that have thoracic flexion or kyphosis, they're rounding in the mid-back, they lose up to 30% of their lung capacity. And we know lungs are vital organs. We need our lungs to expand so we can take oxygen. We need oxygen so we can heal and recover, so we can be alive. For example, for someone who fractured and has to be immobilized, if the lung capacity is decreased, they are not going to be able to clear secretions which pull in their lungs because of this lung capacity. And most patients that are they are losing their life after a hip fracture is secondary to respiratory infection. Here's a little bit more on fracture risk and poor recovery. Secondary to changes, drastic postural changes. Older men and women with hyperkyphotic postures have higher mortality rates. A Journal of American Geriatric Society. In the research journal Spine, we're seeing that height loss was associated with 42% increased risk of coronary events, even in men who had no coronary history of cardiovascular disease. Let me go back here and show you something. You see, as her head shifts forward, she's losing height as well through the spine.
Hey, Margie here. High-quality supplements are a big part of a comprehensive osteoporosis program. To help you, I offer a significant discount every day in my supplement store through FullScript. FullScript has the most extensive catalog of professional-grade supplements and wellness products I've ever found. So all you need to do is go to tinyurl.com. That's tinyurl.com/supplements4less. And you'll get to my FullScript store. And in there, you'll see my favorite bone-building supplements. So make sure to check it out. And the link will also be in the show notes. So let's get back to the show.
Spinal pain, headache, mood, blood pressure, and lung capacity are among the functions most influenced by posture in the American Journal of Pain Management. And now I want to share with you a few case studies. Two of our patients that started working with us in ONERO, and some of the results that I believe were quite remarkable. This patient is 64 years old. She had the scan done at the beginning of the program, and we're particularly interested in this side posture here. You're going to notice that the head angle, maybe you cannot see it, but it's 16%. And we know that anything normal, approaching normal, has to be close to zero. So that's where she started. And then a year later, we retook the picture, and her head has shifted by 11 degrees back, closer to normal. So now she only has 5 degrees, very close to normal. This patient worked with us in ONERO and had other amazing benefits, increase in low bone density in her hip by almost 9%. Before she started ONERO, she lost about 15% the year prior in her bone density in her spine. So that was quite dramatic. And then during ONERO, she was able to maintain her bone density in her spine. Here's another one, 50 years old. Started even in a worse situation, a 23%, 23 degrees forward head shift, January 23. And then 10 months later, over 50% improvement after working in ONERO with us, strengthening the paraspinal muscles, and we're seeing this amazing improvement in posture. She also increased in bone density in her femoral neck by 6.8% and went from osteoporosis to osteopenia in her spine. Another case study here of a patient who worked with us in ONERO. I love to share this. I don't have a posture picture for her because her posture, she already started with good posture. but her bone density, I will share her scan. She started here in 2021, had her first scan. And then she lost about 12% and was measured again in 2023. This is where this low point, she started ONERO with us in 2023. And 10 months later, she remeasured DEXA scan with her doctor, and she had gained it all back and some more. And this is bone density in her spine, 5% in her hip. This is the graph for her spine. And I wanted to share this comes straight from the brochure, the ONERO brochure from the Bone Clinic. I wanted to share it because it does now come full circle for this presentation. It touches upon all the factors that we just discussed. ONERO addresses all those specific movements that we see in those communities that have low fracture rates. And then we're seeing outcomes including spinal muscle strength. And we talked about this in the presentation, how important this is for fracture protection. We're seeing improvements in all the balance scores, improvements in bone density, of course, in the spine and in the hip. We're seeing improvements in body composition. And we talked about how important this is, specifically referring to maintenance and improvement of strength and quality of skeletal muscle. So that's what bone density measures, fat and muscle percentages on the body. And we're seeing improvements there as well. Now, I wanted to bring something in the conversation that we usually don't necessarily discuss in these lectures. But there is something that I wanted to share that I witnessed through my clinical rotation. I have background in nursing and physical therapy, so I spend some time in clinical settings such as nursing homes. So if you have somebody, an older parent or a grandparent that may be fractured and is in nursing home, and you are concerned about their recovery rates, I have a few recommendations for you. If just to help this loved one with their recovery. My first recommendation is that you partner with a physical therapist and that you visit your loved one during the physical therapy sessions, that you encourage them and cheer them along. What I found during my clinical rotation in nursing home, particularly with patients that had fracture, is that they refuse to move. And this is their only ticket to recovery. For these patients, their chances of recovery exponentially increase when a family member is present during the physical therapy times. Now, what are 3 most important exercises that I would recommend for someone like that? Number 1, encourage them to do exercises in which they lift their arms overhead. These type of exercises would encourage the movement of their rib cage and their ability of their lungs to expand. They will increase their recovery rate, their ability to remove secretions from the lungs, and to avoid respiratory complications. Another important exercise is a respiratory exercise with an incentive spirometer. You can get one if they are in a nursing home, or they are very cheap to purchase. And even if your loved one doesn't have a respiratory disease, most likely, if they are in the nursing home or they suffered a fracture, they have lung restrictions. And the third one is a sit-to-stand exercise or a squat if they are able. This exercise involves compound movements, moves a lot of joints at the same time, and meaning that it moves a lot of muscles. And this affords for maintenance of function, ability to sit and stand from a chair, and to preserve their independence. For postural exercises, I want to encourage you right now to perform a postural exercise. Think on the left side of your spine as a cogwheel. And then if you see these arrows, the first thing I encourage you to do, just like we discussed earlier when we're looking at the postural pictures, is the translation of the head back. So bringing the head back with the ear right over the shoulder, and then thinking about aligning these cogwheels in such a manner that you will be achieving an upright posture with the crown of your head reaching towards the ceiling and lengthening by performing a chin retraction exercise. What I find with patients that perform the chin retraction exercise first is that their spine kind of aligns behind the head and they start moving upward. So they are able to align these cogwheels. So you can try this for yourself right now. You can even put a finger on your chin and push slightly back and lengthen your spine up towards the ceiling. Do this while you take a breath in. If I was to recommend one single exercise that would work on all the risk factors for fractures, that would be the squat. The squat is one of the movements that is integrated in the lifestyle of the communities that have low or inexistent fracture risk. And it's a compound multi-segmental exercise, meaning that involves many joints at the same time. It integrates the complexity of human movement, so it transfers into your lifestyle. We need to sit and stand from a chair, strengthens muscles into your, let's go to the next slide, into your back, so the paraspinals, the glutes, quadriceps, and the way we perform it in the clinic with a chin retraction, it actually strengthens the muscles in our neck as well. Here's a representation from humanlocomotion.com. I took this image because I believe it was quite impactful when we're looking at reducing fracture risk in the hip. The squat exercise has the ability to create tension into a particular side in our femoral neck, which is usually prone to fracture. If you are looking here, the representation on the left, this is showing the pelvis is here, and this is the hip bone. This side right here is where is a weaker side in the femoral neck, and we see most of the fractures. When we are performing exercises with the hip bent, such as in a squat or in a lunge, we are activating muscles. Now we're looking from the back here. This is the sacrum, muscles in the back of the hip that insert in that vulnerable point, and traction into that area increases bone density and bone resilience. And this is why most likely we're seeing less fracture rates in cultures that squat for long periods of times, like we were discussing earlier, as opposed to cultures that exercise with their hips straight, such as walking or running. And this is, we already know that walking or running does not have a positive effect on bone outcomes. So I'm going to demonstrate the squat exercise. I'm going to first show the profile posture for this exercise and how you prepare. So if you watch me from the profile, the first thing that you are going to do is a chin retraction. We're going to bring the chin back to have the ear right over the shoulder. From this position, we're going to go about shoulder width with our feet. We're going to take a breath in right here. And on a breath out, we are going to activate the abdominals and go into a squat movement. So here we go. Breath in. And here's the most common error that I have to correct for the squat. So what happened here was that the trunk did not remain upright and the person's chin moved forward. So now I'm going to demonstrate correct form once again. So this is all I wanted to share with you. My recommendation is that if you want to start with a squat exercise, partner with a physical therapist, allow them to observe your form, because most likely you will need some direct feedback and some correction on how to perform this exercise. Thank you so much, and I hope that this was helpful.
Wow, Dr. Claudia, this was just fantastic. And the good news is that this works. This really works. And not only are we getting stronger and we're doing these activities, but it's going to really translate into being more functional, being able to live a better life. I mean, I know you told me the story, someone in the class ended up, changing their tire themselves because they had the strength. And I just think there's just nothing more empowering than having the strength. But it's so important to do things in the right way. And that's why the work you do is so incredible. And I've witnessed it firsthand. I love it. I'm very busy, but no matter what, I've made this a priority in my life. And, the principles are just so great because people become stronger, bone density increases, but even more important, as you said, when you gain that muscle strength, that you're not going to have the fractures. And that's the most important thing, because you are going to be able, to prevent that. So it's just so wonderful. And I'm so grateful to you. And yes, that class is still available. It was really, people can get it on my website, or I'll let people know more about that. But yeah, this is just so wonderful. And, I just want to spread this to everybody, because for so many years, as you said, we were doing things subpar. We weren't doing enough exercise because people were afraid, oh, that's too much for someone with osteoporosis. And that thinking really wasn't serving anybody. So now the new thinking but it's very important to do it properly, not to just go and, randomly start doing the exercises yourself, because it's key to have the supervision and to make sure that it's done in the right manner. And so, yeah, so I'm so lucky. I just think it was meant to be that you lived 25 minutes, that your program was 25 minutes away. And I see the people benefiting. It's fun when you do things together. And the nice thing, and I know Belinda will talk about how, the ONERO itself is spreading. But tell people where you're located, because anybody that lives people travel far, Dr. Clark. Get over. I live 25 minutes, but there are people in our class that are traveling over an hour. Why don't you share exactly where you're located?
So we're in Somerset, right off 287, exit 12. So it's super easy to get to us. And we do have patients that travel super far. And they still come, and they haven't been missing. Everyone is super committed. And I'm super committed. I love this work. And what it allows me to be part of is just such an amazing gift to my community. And also, I enjoy it. I love it. I love to partner with patients and see them just transforming through this program. Not only their bodies, their physical bodies, see this amazing potential emerging physically, but also the mindset. They are not afraid. They are becoming confident. Everything is just falling into place. Even some things that I didn't even consider, like psychological factors and stuff like that. The energy of the groups when they come together and they empower each other, and it's just so fun to walk alongside these women, and it's mainly women. But yes, it's just been an amazing opportunity, and I'm so grateful that you're allowing me to share all this. And there's so much to share. So I'm just very very grateful to be here today.
What excites me so much is that, It's just that you're right, though, about the group. There is something special. So when you can be in part of a group and everybody's working together, there's that energy. But when, again, I think what's happened, people are so fearful. And, I always say the same thing, that a diagnosis of osteoporosis is an opportunity to make changes in your life. And you look back and you say, wow, that was a blessing in disguise. So when there were a lot of people who were couch potatoes, when you see these women now lifting, you're like, oh, well, a lot of people say, oh, well, they were already doing that. That's not true.
Wow.
There were people from never exercising. And, it's never too early, but it's never too late. And that's what I love. And not everybody, everybody works at their own level. But I think the exciting thing is you do see results. And it is. I love it. As I said, I've completely changed my schedule to make sure I could do this. And it's just, there's nothing better than feeling really strong in body, mind, and spirit. And that's what happens when we do these things. And so I'm so grateful to you, Dr. Claudia, for you have such an amazing program. And it's just been, as I said, I'm going to do this. And I guess I can share a little more about the story. So I said, when you came on the podcast, I said, you know what? I'm going to do this. But it took me months. It took me from February to April to really be able to come. But then when I came, the people in there had heard about it through the podcast, and they had been coming already for a couple of months, and I couldn't get over what they had done. It made me so happy that I was able to share what you have done in the ONERO program, and just to see the change in people's lives. So everybody listening, this is so possible. And I'm so happy that this year I'm able to have Dr. Claudia on here. And the information she talked about is, it's just so important. And start with the squat and the neck exercise that you can do throughout the day. It's just so powerful. So anything else you want to say before we end?
I just want to say that these women that come in in the program, most of them are deconditioned. They've never exercised. They've never even seen themselves exercising. And now all of a sudden they see themselves as athletes. They have the athlete mindset, and it all comes together in looking at all these factors, just like I presented through the PowerPoint. Now they start looking at muscle strength and quality. How is this affecting their movements? And then they come back with real life stories. And that's what's really most important for me, that if we're offering an intervention that can stand in the face of reality, right, it is not just going to fall apart if the patient goes home, right, and they have to carry their laundry upstairs and they fall. Things like this is the test of reality. If we're giving an intervention that's able to do this for our patients, that's what I care about, because that's what's going to be the most impactful. Otherwise, little things like they are below that threshold. They are not making a change, not causing an adaptation. I was never for it. I feel like I'm failing the patient if it doesn't stand the test of reality.
Oh, so true. So true. So I invite all of you to become exercisers and start, wherever you are. Anything and anywhere to begin is a good start, and just moving you on the right path. So it's just so wonderful. Well, thank you so much, Dr. Claudia. And I see you all the time, which is so fun. And so, but just thank you for sharing all the wonderful information you presented and all the work you do, because you put your heart and soul into this, and you've changed so many lives. And that's what's really amazing. And I think, this program is expanding, and just, I think you lead by example what can be done. So thank you so much.
Thank you, Margie.
I hope you enjoyed my interview with Dr. Claudia as much as I did. I now feel empowered to put this information into your life, because it really will make a difference. In the show notes, I've included some resources that can help you on your path. So number one are 2 classes that Dr. Claudia did with my community that were outstanding. One was on core activation, and the second was on foot and ankle strengthening exercises to prevent falls and fractures. And so you can purchase them individually, or they're also part of my Happy Bones Club membership. Also, Dr. Claudia's talk was one of 70 that were in my most recent summit, More Natural Approaches to Osteoporosis and Bone Health. So even though the summit is over, it's still available to purchase, and I'll have that link as well. So I can't thank you for being part of this podcast, listening. And if you've enjoyed it, please subscribe so you don't miss any upcoming episodes. And it's also a good way to get the word out to people about this information because it is so important. So thanks again, and I look forward to seeing you on the next episode.